It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks for joining us, my friends. Do you remember the Russian hoax? Do you remember the impeachment? And now we have COVID. Interesting series of events, my friends. Today we're going to talk about facts, always facts. And I've said many times, facts sometimes are frightening things. But what is happening in our country today? What are the true facts? Well, we can tell you what's happening in Schuylkill County and probably nationwide as well. Joining me today, no stranger to the Sam Lesante Show, Dr. David Moylan, excuse me, who is a Schuylkill County Coroner. And we're going to discuss some things about the Chinese virus. Talk about the hydrochloroquine, and also talk about a good friend of his, Dr. Redfield. You know who he is once you see his picture. Dave, it's always nice to see you.
Sam, I don't believe I'm saying this, but I actually look forward to some of these encounters with you.
Well, David, we have seen so much nonsense in the last year or two that it's just sad, okay? And if it was reversed, if it was a Democrat or a Republican, what has happened in this country is sad. And then you have this COVID from the Chinese virus and man-made, from what I understand, and we have the sorrows and the pains that we have in this country. Indeed. Because and right now, my personal feeling is a lot of it's political, and this thing for power and they're destroying the country. I really think they're destroying the country. But that's my personal opinion. Let's talk about what you are presenting today.
Sam, I think your emphasis on the importance of facts is very true, because as it's been said many times, you're allowed to have your own opinion, but not your own facts.
Isn't that the truth? Well, let's talk about what we have today.
Okay, well, starting this off, and we've called it the coronavirus for coroners, because again, in our office in Schuylkill County, we emphasize continuing education for all our deputies, and we have monthly meetings with all the deputy coroners. And this is particularly important to keep everybody up on their toes with this highly contagious virus. But I call it the Wuhan Chinese virus. And again, there's nothing political there. That's just where the thing originated. And it is very common in medicine to label epidemics, diseases by their site of origin. For instance, Lyme disease from the deer tick. That was described up in Lyme, Connecticut. So it's Lyme disease. And Ebola, that was from a river valley over in Africa. So this is the Wuhan Chinese virus, straightforward, nothing political about it. But I'd like to just review with the viewers some statistics. And the first slide is showing death tolls in the United States this year from our seasonal influenza A and B. And the data varies, but let's say on the average it's about 24,000. The Wuhan Chinese virus, it's topped 160,000 deaths in the United States. So this is a real phenomenon.
May I interject something here? Okay. Now, I'm not questioning the deaths, and let me be the devil's advocate today on the show. COVID-19, okay, from what I've heard in the past year, is that what happens, the CDC says now, if someone has in a hospital or is sick with maybe diabetes or influenza, the flu, and they happen to get the COVID virus and they die, they're attributing it to COVID-19, the death. Is that factual, or is that just something that I read in?
No, I think you've read it. It's when we do an after-action report, when all the smoke settles, this will have to be dissected out. But I reviewed the death certificates in Schuylkill County, and I had one physician I'm proud of who made a point of taking COVID off the death certificate because the person had it, and recovered from it the month before and died of another unrelated medical condition.
But they contributed to COVID.
No, they did not.
They
The
pulled it
doctor,
out.
the
Okay.
doctor would not permit that to happen.
Here again, this is a serious thing. I'm not making light of it. But the point is, when you talk about statistics and facts, the only way you could see it is when you're doing an autopsy. You could actually see it. That's a fact. Like this doctor pulled it because he saw that. Many people do not have that ability to knowing exactly what happened, that they're contributing it to COVID, okay? And again, it's a serious thing. But are we getting the real facts? That's the only thing I'm asking you, Dave.
And I'm going to tell you, it hasn't been determined yet.
Okay.
And when this is all analyzed, we'll take that into account.
All right, continue on.
You know, so in this slide, I'm comparing or listing death tolls for Americans from other catastrophic events in our lifetime. And certainly Vietnam was only 58,000. I'm saying only 58,000 deaths.
Senseless.
And the Wuhan death toll is over 160,000. And then we'd like to look at influenza A and B as of yesterday, and the corona cases, documented with caveats there, throughout the world is close to 5 million cases, and regular influenza for this past season was 47 million. So this is much more contagious, and it has a higher death toll than regular influenza. And just to look at how the death toll from influenza varies in our country over the last 10 years, and the CDC, and we're going to talk about the director of the CDC later, but they reported death tolls in the United States for the last 10 years. And a decade ago, it was 37,000. Then it went down to 12,000, bounced up to 43,000. In 2015 season, it was 51,000. And this past 5 years, it ranged from 23,000 up to 61,000. So it's highly variable. You know, the strain of the seasonal flu can vary in intensity. But this is what has the CDC taking pause. What if we have a real bad seasonal flu coming up this October through January? Let's say it hits 60,000. 60,000 on top of what we're experiencing now will be a problem, and that's why the reason for caution. Mm-hmm. The next slide is looking at deaths. Again, these are CDC figures for year 2017, the last year that they had available, and it looks at the other killers in our society. Number one being cancer, heart disease still very significant at 365,000. And then I had the analysis done on a per day basis. So every day, 1,600 people die of some form of cancer. 1,000 die of some form of heart disease. Significant deaths are also due to chronic lower respiratory things, pneumonia, COPD, emphysema. These are all killers. This reminds me to remind our viewers that they should stop smoking. Please stop smoking, because that backdrop sets you up for death from this respiratory virus. The other things that I cataloged were the yearly death toll from suicide. It's about 129 people per day in the United States. And then drug-related deaths, it's about 70,000 a year and 192 per day. How is that going to be affected by the Chinese Wuhan virus? It's not known, but it is definitely being studied, and I'll talk about that. And then there is some experience from some previous viral outbreaks, respiratory disease, and they're listed here, worldwide deaths from SARS, relatively few deaths. The MERS virus from the Middle East, 858 deaths, and then the H1N1 virus. So these all dwarf in comparison with the Chinese Wuhan virus. And as I said before, we take this threat seriously, and the deputy coroners are drilled in this protective gear, personal protective equipment. And this just shows a couple of our deputies on the scene. And then we have our own transport vehicle in the Schuylkill County Coroner's Office. And then there has to be some interaction with the decedents in the morgue for testing. And we do test selected patients for the virus. It's a blood test, so it records whether or not they had exposure, within the weeks prior to. And again, we talked about the effect of the virus on suicides. We're tracking that in our county. We're now 7 months into 2020, and we've seen 14 suicides. That is pretty much on par with the experience we've had in the last 2 years. So I expect that we'll probably have under 30 suicide deaths by the end of 2020. So that's, the Schuylkill Countyans are handling it mentally okay in that regard. However, drug-related deaths. We're in another epidemic. We've got the Wuhan virus pandemic, but we have drug-related deaths. And this year so far, 7 months into the mission, we've had 71 drug-related deaths. And these are all confirmed with toxicologies. There might be a few more that the toxicologies are still pending as we talk today. But this compares with going back 5 years. 2015, there were only 19 deaths. Then the epidemic started, went up to 60 deaths. Following year, 48. In 2018, 79 deaths. Last year was the high water mark so far at 92. I'm expecting that we're going to top 100 drug-related deaths.
Now we come to the
this next slide is meant to show how Schuylkill County compares with the other counties surrounding us. And our neighbor, Schuylkill, has about 142,000 souls in it. Carbon is probably in the 56,000 or so inhabitants. These two counties have been relatively spared, very rural counties. And in Schuylkill, we've had 49 deaths as of today, and in Carbon, 28 deaths. Our neighbors to the north, south, and east have been hammered. You can see on the slide, Lehigh had close to 5,000 confirmed cases with 335 deaths so far. Berks County, over 5,000 confirmed cases, 367 deaths. And Luzerne, no slouch here, 3,300 confirmed cases and 183 deaths.
Folks, I'm talking to Dr. David Moylan, talking about the Chinese flu, or the Chinese virus, and some of the facts. Interesting, folks. I hope you all have faith in something, because we need a lot of prayers in this country. And you see what's going on in the world today, you wonder. We'll be back right after this. Thanks for staying with us, folks. I'm Sam Lesante. Remember, 247ssptv.com. Now, those of you who live in Schuylkill, in the Pottsville area, we're on Comcast 190. and we're on 7 p.m. to 11 p.m. every day. In the Wilkes-Barre, Scranton, Mountaintop, Kingston on Service Electric 92, Saturday and Sunday evenings from 7 p.m. to 11 p.m. In the Scranton area, Lackawanna County on Comcast 190, Saturday and Sunday mornings from 8 a.m. to 11 a.m. My guest today is Dr. David Moylan, who is the Schuylkill County Coroner, talking about the Chinese virus and the analysis of Schuylkill County, because you alluded to this when you were on in April, whatever. So this is like an interim report, correct? So let's talk about the analysis here.
Well, so far through today, we've had 49 deaths. And again, it's an elderly population that's dying. And in our data, the average was 79 years old. And as it would turn out with the national trends, 67% of our deaths have been in nursing homes. And we always hear about comorbid conditions, other underlying illnesses, and they're definitely a factor in our group. 61% had high blood pressure, 54% had some form of heart disease, 37% had diabetes, and we know diabetes interferes with healing, and diabetics are notoriously more susceptible to various infections. And then we have our chronic lung patients, and about 30% had either emphysema, restrictive lung disease, etc. And in the breakdown of our patients, about 70% were males. Although other series with different age groups, it's been more like 50%. We are testing. Testing is available through the state and private labs in Schuylkill County, and these are called PCR tests, and that stands for polymerase chain reaction. And it's basically taking swabs from deep in the nasal cavity and plating it out and checking it for the viral DNA particles or RNA particles. And that's been very accurate. Now, how do you treat this damn thing? It's mentioned here, quarantine, get plenty of rest, stay hydrated, Tylenol for fever, and monitor your symptoms carefully. Contact your healthcare provider. But when this first came on the scene back in March and April, my wife, Dr. Denise Moylan, who is a lung specialist, she said this Plaquenil, it's hydroxychloroquine. It's used to treat arthritic conditions. It's used for preventing malaria when you're about to take a trip to a malaria endemic area. And she reviewed her scientific material and even sent a letter to President Trump saying that this should work. And there was some preliminary work being done over in France. And gosh, I had great hope for this. It did not pan out. I don't know why it did not pan out, but there were a lot of political maneuverings going on. But I've taken, for this presentation, I did review some of the literature. And we're going to show a picture of the French infectious disease specialist, microbiologist. His name's Didier Raoult, MD. And he looks a little wild-eyed, but his data, I think, is very solid. And you have in front of you a paper that was printed in Travel Medicine Infectious Disease just at the end of June. This is a very, very comprehensive study, Sam. It looks at over 3,700 patients. Now, again, one of the criticisms for it, it wasn't a randomized study. By that, I mean 2 patients come in, you flip a coin, patient A gets the treatment drug, patient B gets a sugar pill. a placebo, or best supportive care. It was not that kind of study, but they aggressively tested, and this was done in Marseille, France. They aggressively test for the virus. If you were positive, you were started on the therapy. And there were several different treatment groups. One was using the hydroxychloroquine plus the antibiotic azithromycin. And that is the famous Z-Pack, which you take for 5 days. So you're taking the Plaquenil or the hydroxychloroquine for 10 days, you take the Z-Pack. And that was the treatment. In another group, they just gave them the hydroxychloroquine, and the other group got just Zithromax, and another group, about 140 patients, did not get any.
Very quickly, before we go to break, when you're talking about this, the hydroxychloroquine, where Trump had mentioned that, you know, this may be a good thing to take, okay? And fortunately, you hear good reports, and then you hear not good reports. There's a representative now, Republican representative, who took it and said it didn't work on him, but that doesn't mean it won't work on someone else. So I think what happens is, you know, with the, here again, not to become political, with the wacko press that we have, and I'm being kind, you know, they're not going to emphasize the pluses, but you hear the negatives, okay? Like you hear, like you're seeing now with, you know, they're desperate to try to get the country back, so they'll do anything they possibly can, lie to the American public, and you see this all the time, okay? So the point is, if your wife and other doctors think it's good to take, you have mixed emotions. Do we take it or don't we take it?
For myself, I would not hesitate.
You would not hesitate?
Not a New York minute.
I'm going to take a quick break. I want to come back. I know you're very good friends with Robert Redfield. You went to school with him. I want to talk a little bit about him. Folks, you're watching the Sam Lesante Show. Interesting stuff. Don't be fooled, my friends. Don't be fooled. Don't let the press lie to you like they've been lying to you, the liberal press. No one's giving you facts. They might want you to believe they're giving you facts. In fact, they come on really professional and with music, and they just got to be true. Nonsense. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. My email, sam@ssptv.com. My guest, Dr. David Moylan, talking about the review of the Chinese virus, analysis of it, and some of the things with the medicine, etc. Pick up where we...
well, yeah, just briefly, we're running out of time. The French study in Marseille, it was a younger population. The average age was about 45, but the mortality was only 1.1%, which is spectacular. And their recommendations is get your testing done as soon as possible. Get on this really innocuous medication. Z-Packs are prescribed daily throughout the United States. The Plaquenil, also very safe drug. Perhaps get an EKG, make sure there's no predisposition.
What are your feelings about the vaccine? Then we get to Redfield.
I'm enthusiastic about the vaccine. And again, normally it takes years to get these things through. President Trump, he created a new moonshot, this accelerated vaccine testing approval. I think it'll be out within the next couple of months, and I would line up to take it personally.
Okay. Of course, you won't read about that or hear about that because that's interesting. You know, it's interesting very quickly when the people get upset sometimes, especially the wackos. They get upset when I talk about these facts, okay? 226 newspapers when Trump ran, 226 newspapers, 213 were negative on Trump, you know, and in the state of, so you don't see a fair balance here, okay, no, which is very sad. And I don't care whether Trump is Democrat; it would be the same thing. No. Let's talk about your buddy Robert Redfield, who is the director of the CDC.
Robert Redfield and I went to Georgetown University School of Medicine. We graduated in 1977. I saw him 3 years ago. We had dinner down in Washington, and little did I know that he would be targeted for this position, but he is head of the CDC, He's a very smart gentleman, and I think our country is well served by having him at the head of the CDC during this crisis.
Dave, there's information. We talk about facts, okay, and sometimes I say facts are ugly things. What do you, as a doctor, what do you think it looks like in the near future, coming towards the end of the year?
Sam, I think we're coming out of this. You know, we did have a surge on this, but I think it's starting to quiet down again, and I'm confident that we'll be out of this by the end of the year.
Good. Dr. David Moylan, folks. Remember, watch him on Modern Medicine. Very interesting guest that he has. It's on our systems, all the systems. Modern Medicine does a great job. Dave, thanks for coming on the show.
My privilege.
Remember my email, sam@ssptv.com. Always welcome the people who have other viewpoints, as they say, on the show. I haven't received any yet, but I'm open for it. It's sam@ssptv.com. See you next time.